Hello everyone. In this video we'll be discussing on the topic of screening and oncology. So the meaning of screening is that we will be discussing the various types of lab diagnosis and instrumental diagnosis. So diagnosis means the histological examination that includes like detecting the cancer cells in the slides or histological examination on a microscope or biopsy, and instrumental diagnosis like instruments we use like CT scan, x-rays, fluorographies and all, colonoscopy, endoscopy. So these are comes under the instrumental diagnosis. So these are the common ways to diagnose the cancer, and the specific diagnosis method depends on the type of cancer. Now screening is a process involving testing patients to identify a disease that has not yet developed. So screening is done to identify the patients who has not developed any type of cancer or any type of disease. Now, which disease are suitable for a screening test? Now first is the natural course of disease is well studied, so we should know the natural course of the disease. It should be studied thoroughly, and if the disease is recognized in an early stage. So screening is done for those disease which are diagnosed or recognized at early stage, like you have detected in microscope or slides that it is maybe chance of cancer. Then you can go for the some screening test, specific screening test for that type of cancer. And third point is the treatment at early stage is more effective than the later stage. So this is a most important point. So treatment, if we detect any cancer before its metastasis or further transmission or further progress of that cancer, if it is detected at early stage, then there is chance of treatment is possible. Now if the disease is common in local population, so it is also important for screening test. If that disease is common in that target population, then it is very suitable for screening test. Now what are the requirements for screening test? First point is like sensitivity and specificity is important. Sensitivity meaning is that the proportion of people who are positive, and specificity is meant meaning is that number of people who are negative for this disease. So that screening method will be called as ideal test, which test is having the sensitivity and specificity both. Okay. Now acceptable, the meaning of acceptable is the test should be valid and approved by government. So it shouldn't be like an approved test or like by black means or any other way of producing the test. So it should be well planned and written in the government or the medical organization that this test is acceptable. Now third is the test should be safe, that test should be safe with less complications and side effects. So the test should be safe for the patient who is going to be done. The test should be done on that patient, that should be safe for that patient, and it should be inexpensive. Okay, so fourth point is it should be inexpensive. So the test should not be costlier to the patient, not so much expensive test. So these are the four requirements for the screening methods. Now conditions exist for conducting screening programs are like high quality of treatment or detected disease. So if the cancer or disease has been detected, then there should be a high quality treatment for that type of disease. Now second point is repeat screening at regular intervals of the disease has a latent onset. If disease has a latent onset, meaning is that if the disease develops later on, so we should do regular interval screening test for that disease. Okay. Now third is the suitable conditions for diagnosing the patient's positive. Now we should know the conditions when the patient can be positive. So there should be a suitable condition when the test is to be done so that the patient is positive. So the appropriate time and the condition of the patient should be taken in mind. And fourth is there should be no harm to the physical and the psychological status of the patient. So there should be no physical and psychological harm to the status of the patient. Now fifth point is the benefit should justify the cost of screening test. So the test which we are doing on the patient to confirm the diagnosis, that should be cost effective, and that should determine the cost of the screening test. Okay. And third point is the and some point is like treatment of disease in early stage is most effective than the treatment at later stage. This is clear. And when screening, it is important to avoid large number of tests in target population. Like if we know that in this population there can be some gene mutation or some type of communicable disease or communicable or genetic mutation in that target population, then we should avoid the screening in that large number of populations. Okay, and if second point is like genetic screening, like genetic or family history is there for any patient who has developed cancer, so in that patient's family screening and relative should be done for that disease due to the family history. So like genes, we have like gene mutation of APC gene in the adenomatous polyposis. This is a type of cancer, and BRCA gene 1 and 2 in the breast and the ovarian cancer. So these are the most common genetic mutations occurs in the female. Okay, now we have fourth, we have the now we will see the specific type of breast cancer screening, and this one is a mammography. Mammography has become the recognized test, and it is effective in the age of 40 to 50 years. Okay, so the most common diagnostic method in the case of breast cancer is our mammography, and if it is most common in the age of 40 to 50 years of age of females, and we can go for ultrasound and biopsy also to confirm the diagnosis. Okay, and breast self examination and medical examinations have proven to reduce the number of death. So we should check the breast health by our own self, so that will be more useful for the females to detect the breast cancer. So you can see this mammography here. So this is the mammography here. You can see this is the malignant, this is the malignant part, and this you can see this mammography, this malignant area, and this is the benign breast cancer, and this is a malignant. So this image you can see, this is actually your mammography. Okay, so this is the image you will see in the case of mammography, and this is one more. You can see these are the nodules you can see in the breast, and this is the confirmatory diagnosis for the breast cancer, and the test investigation method is mammography. Okay, so this was the breast cancer screening. And if we talk about the colon cancer screening, so what test we do is the colonoscopy is the first method to diagnose colon cancer, and it is done at the age of 50 years with a patient with GIT symptoms. So the patient who are having any gastrointestinal symptoms, so then we go for the colonoscopy. So colonoscopy, you can see like images of colonoscopy, you can see it here, and these are the images of colonoscopy. So these are the cancer you can see. This is A, B in the images, and this you can see this reddish area. So these are the cancer cells here which has been developed in the colon. Okay, so these are the colon screening image of the colonoscopy. And one more image, you can see the stages of colonoscopy like this. You can see staging of the cancer, like stage 1 will be small size, stage 2 here, stage 3, stage 4 will spread to the cancer to the other organs. So it is spreading to the other organ. This is the colon, you can see this colon, this part, and between that there is a tumor cell, this nodule you can see, this is the tumor. Okay, so this much is clear. Now we have the cervical cancer. So in the cervical cancer we have to do like pap test. In this colon cancer, in the early diagnosis we can do some capsule endoscopy. This is another type of endoscopy which we do in the early diagnosis, and histological examination also. In cervical cancer we do pap test, the specific test for cervical cancer. Okay, and pap test is effective here. Okay, cytological examination, this is type of cytological examination, and in the cervical cancer we have higher risk after the 25 years in females. And the pap test, you can see pap test, this is the image for the pap test, you can see it here, and this is the cervix, and this is a scapulum from which cell from the cervix is taken out through this brush. You can see this is the zoomed image of this, is a zoomed image of this instrument, and this is the cervix, and the brush cell is taken out, and this position, you can see this position is lithostomy position, and the patient is placed and the speculum is inserted inside the cervix, and from that then some part of cervix is taken out, and then the histological examination is done to detect the cancer cells. So this is called actually as pap smear test for detecting the cervical cancer. Now we have the lung cancer. So lung cancer is most commonly cancer with the patients who are smoking, and we do the chest x-ray, but chest x-ray is not our priority of investigation method because it does not reduce the risk of death, but CT scan is the most prominent and can reduce the mortality. We can also do sputum examination, like we can detect in the cuff we can detect some bloody sputums and cancer cells by histological examinations. And finally we can do the lung biopsy, which can be the perfect diagnosis for the lung cancer. And this you can see some fluorography. In fluorography, this chest x-ray you can see here. This nodule you can see it here on this one. So this is actually your lung cancer here. Okay, so this is the image of fluorography or chest x-ray, and this is a nodule in the lung. And this image you can see this metastasis, this cotton wool form, cotton wool, this all spread of the cancer here. Trachea is somewhat shifted. Okay, so this is an image for the lung cancer, and these are the CT images, the confirmatory diagnosis. Simply in this, these are the lungs, and you can see this blood vessels and all these hilums, but here you can see the whitish, opaque whitish part, and this is actually your cancer here. Okay, like this you can see one more image. This is a small cancer, CT scan of small lung tumor, left upper lobe. So this is the left upper lobe, you can see this here, this is the left upper lobe. So these are the screening methods for the lung cancer. Like CT scan is the best method to detect the lung cancer. Thank you.